1. What is the best action for the nurse to take before administering a medication through a nasogastric NG tube? Answer. Verify proper placement of the NG tube. Rationale. Verifying NG tube placement, e.g., by checking pH of aspirate or X-ray confirmation, prevents medication administration into the lungs, ensuring patient safety. Misplacement can cause aspiration pneumonia, per Joint Commission standards. 2. What should the nurse do first when a patient reports a new onset of chest pain? Answer. Assess the patient's pain and vital signs. Rationale. Assessment is the first step in the nursing process, prioritizing patient safety. Evaluating chest pain characteristics and vital signs, e.g., heart rate, blood pressure, guides further action, per American Nurses Association, ANA, standards. 3. What is the priority action for a nurse assisting a patient with ambulation after surgery? Answer. Ensure the patient is stable and use a gait belt. Rationale. Patient stability and a gait belt prevent falls, a leading hospital safety risk. Assessing balance and securing the patient promotes safe mobility, per Joint Commission fall prevention guidelines. 4. What should the nurse do when preparing to bathe a patient with a central venous catheter? Answer. Cover the catheter site with a waterproof dressing. Rationale. Protecting the catheter site prevents infection, a serious complication. Waterproof dressings maintain a sterile barrier during bathing, per Centers for Disease Control and Prevention, CDC, infection control guidelines. 5. What is the first action for a nurse when a patient's blood pressure reading is 180/100 mmHg? Answer. Retake the blood pressure to confirm the reading. Rationale. Accurate vital sign measurement is critical. Retaking the blood pressure ensures the reading is not due to equipment error or technique, per ANA standards, before notifying the provider. 6. What should the nurse do to maintain a septic technique during a sterile dressing change? Answer. Use sterile gloves and avoid touching non-sterile surfaces. Rationale. A septic technique prevents wound infection. Sterile gloves and avoiding contamination maintain a sterile field, per CDC infection control guidelines. 7. What is the best action for a nurse when a patient refuses a prescribed medication? Answer. Explore the patient's reasons for refusal and educate about the medication. Rationale. Respecting patient autonomy while addressing concerns promotes informed decision-making. Education may resolve misconceptions, per ANA ethical standards. 8. What should the nurse do to prevent pressure injuries in a bedridden patient? Answer. Reposition the patient every 2 hours and assess skin integrity. Rationale. Repositioning redistributes pressure, preventing tissue damage. Skin assessment identifies early injury signs, per National Pressure Injury Advisory Panel, NPIAP guidelines. 9. What is the priority action for a nurse when a patient's pulse oximetry reading is 88%? Answer. Administer supplemental oxygen and notify the provider. Rationale. A pulse oximetry reading below 90% indicates hypoxemia, requiring immediate oxygen therapy. Notification ensures timely intervention, per American Association of Critical Care Nurses, AACN standards. 10. What should the nurse do when documenting a patient's fall in the medical record? Answer. Record objective details of the incident and the patient's condition. Rationale. Accurate, objective documentation ensures legal and clinical accountability. Details guide care and quality improvement, per Joint Commission documentation standards. 11. What is the best action for a nurse when a patient with dementia becomes agitated? Answer. Use a calm tone and redirect the patient to a familiar activity. Rationale. A calm approach and redirection reduce agitation without escalation. This promotes patient comfort and safety, per Alzheimer's Association care guidelines. 12. What should the nurse do to promote urinary elimination in a postoperative patient? Answer. Encourage fluid intake and assist with timely toileting. Rationale. Adequate hydration and timely toileting prevent urinary retention, a common postoperative complication, per ANA standards for fundamental care. 13. What is the priority action for a nurse when a patient reports severe pain after surgery? Answer. Assess the pain's location, intensity, and characteristics. Rationale: pain assessment guides appropriate intervention and ensures patient comfort. Detailed evaluation informs medication or provider notification per Joint Commission pain management standards. 14. What should the nurse do to ensure safe transfer of a patient from bed to chair? Answer: use a transfer belt and assess the patient's strength and balance. Rationale: a transfer belt and assessment prevent falls during transfers. Ensuring patient stability promotes safety per Joint Commission fall prevention guidelines. 15. What is the best action for a nurse when a patient's foresight shows redness and swelling? Answer: stop the infusion and remove the forecatheter. Rationale: redness and swelling indicate phlebitis or infiltration, requiring immediate cessation to prevent tissue damage or infection per Infusion Nurses Society, INS, standards. 16. What should the nurse do to promote patient dignity during a bed bath? Answer: cover the patient with a blanket and expose only the area being washed. Rationale: maintaining privacy and modesty respects patient dignity, a core nursing principle per ANA Code of Ethics. 17. What is the priority action for a nurse when a patient's temperature is 103 degrees Fahrenheit? Answer: administer prescribed antipyretics and notify the provider. Rationale: a high fever requires prompt intervention to prevent complications like seizures. Notification ensures further evaluation per CDC fever management guidelines. 18. What should the nurse do when preparing a patient for a surgical procedure? Answer: verify the patient's identity and surgical site. Rationale: verifying identity and site prevents wrong site surgery, a critical safety measure per Joint Commission Universal Protocol. 19. What is the best action for a nurse when a patient expresses fear about an upcoming procedure? Answer: listen actively and provide clear, reassuring information. Rationale: therapeutic communication reduces anxiety and builds trust. Clear information empowers the patient per ANA communication standards. 20. What should the nurse do to prevent aspiration in a patient with dysphagia? Answer: position the patient upright and offer small, thickened bites. Rationale: an upright position and modified food consistency reduce aspiration risk per American Speech-Language Hearing Association, ASHA, dysphagia guidelines. 21. What is the priority action for a nurse when a patient's bed alarm sounds? Answer: respond immediately and assess the patient's safety. Rationale: immediate response prevents falls, a priority for patient safety. Assessment identifies risks per Joint Commission fall prevention standards. 22. What should the nurse do when administering oral medications to a patient with difficulty swallowing? Answer: check if medications can be crushed or given in liquid form. Rationale: ensuring safe administration prevents choking or aspiration. Verifying compatibility maintains efficacy per Institute for Safe Medication Practices, ISMP, guidelines. 23. What is the best action for a nurse when a patient's oxygen cannula is dislodged? Answer: reposition the cannula and ensure proper oxygen flow. Rationale: correct placement ensures adequate oxygenation, preventing hypoxemia. Checking flow maintains therapy per AACN oxygenation standards. 24. What should the nurse do to promote bowel elimination in a patient with constipation? Answer: encourage high-fiber foods and increase fluid intake. Rationale: fiber and hydration soften stool and promote peristalsis, preventing complications like impaction per ANA fundamental care standards. 25. What is the priority action for a nurse when a patient reports feeling dizzy while standing? Answer: assist the patient to sit or lie down and assess vital signs. Rationale: preventing falls is critical. Sitting or lying down and assessing for orthostatic hypotension guide care per Joint Commission safety guidelines. 26. What should the nurse do when preparing to insert a urinary catheter? Answer: use sterile technique and verify the catheter size. Rationale: sterile technique prevents urinary tract infections, and correct sizing ensures comfort and function per CDC catheter-associated UTI prevention guidelines. 27. What is the best action for a nurse when a patient's wound dressing is saturated? Answer: Change the dressing using a aseptic technique. Rationale: a saturated dressing increases infection risk. Aseptic technique maintains a clean wound environment per CDC wound care guidelines. 28. What should the nurse do to ensure accurate intake and output measurement? Answer: record all fluids consumed and excreted precisely. Rationale: accurate measurement monitors fluid balance, critical for detecting imbalances like dehydration, per ANA documentation standards. 29. What is the priority action for a nurse when a patient with a tracheostomy has difficulty breathing? Answer: suction the tracheostomy and assess airway patency. Rationale: obstruction is a life-threatening emergency. Suctioning clears secretions and assessment ensures airflow, per AACN tracheostomy care standards. 30. What should the nurse do when a patient requests pain medication 30 minutes after the last dose? Answer: assess the pain and review the medication administration record. Rationale: assessment ensures safe dosing, preventing overdose, while addressing pain promptly, per Joint Commission pain management standards. 31. What is the best action for a nurse when a patient's family member asks about the patient's condition? Answer: verify the family member's identity and share information per patient consent. Rationale: protecting patient confidentiality is a legal and ethical duty. Consent ensures privacy, per Health Insurance Portability and Accountability Act, HIPAA regulations. 32. What should the nurse do to prevent deep vein thrombosis in a postoperative patient? Answer: encourage early ambulation and apply compression devices. Rationale: ambulation and compression promote venous return, reducing clot risk, per American College of Surgeons, ACS, DVT prevention guidelines. 33. What is the priority action for a nurse when a patient's pulse is irregular? Answer: assess the pulse for 1 minute and obtain an ECG. Rationale: an irregular pulse may indicate arrhythmia, requiring accurate assessment and ECG confirmation per American Heart Association, AHA, standards. 34. What should the nurse do when preparing a patient for a meal? Answer: position the patient upright and ensure a clean, safe environment. Rationale: an upright position prevents aspiration, and a clean environment promotes comfort, per ANA fundamental care standards. 35. What is the best action for a nurse when a patient with a hearing impairment struggles to communicate? Answer: use written communication or a sign language interpreter if needed. Rationale: effective communication ensures patient understanding and inclusion, per ANA standards for culturally sensitive care. 36. What should the nurse do to maintain a safe environment for a patient with seizure precautions? Answer: pad the bed rails and keep suction equipment nearby. Rationale: padding prevents injury and suction ensures airway safety during a seizure, per Epilepsy Foundation guidelines. 37. What is the priority action for a nurse when a patient's NG tube output is 500 milliliters in 2 hours? Answer: notify the provider and assess for signs of GI bleeding. Rationale: excessive output may indicate bleeding or obstruction. Notification and assessment ensure timely intervention, per ANA clinical standards. 38. What should the nurse do when a patient with diabetes reports shakiness and sweating? Answer: check the patient's blood glucose level and provide a fast-acting carbohydrate. Rationale: symptoms suggest hypoglycemia, requiring immediate glucose testing and treatment to prevent complications, per American Diabetes Association, ADA, guidelines. 39. What is the best action for a nurse when a patient's call light is not functioning? Answer: check on the patient frequently and report the issue for repair. Rationale: frequent checks ensure patient safety and reporting maintains a functional environment, per Joint Commission safety standards. 40. What should the nurse do to promote sleep in a hospitalized patient? Answer: dim the lights and minimize noise in the evening. Rationale: a quiet, dark environment supports the sleep-wake cycle, improving rest and recovery, per ANA fundamental care standards.